Frank Thompson is here now from the Kansas City Health Department, and I know your focus is on HIV prevention. So tell me about your efforts to address HIV in your community.
Right, and I'm actually doing Ryan White, so I'm actually the HIV care side of the program. And we focus on several areas that we feel are really important. First being housing, improving both access to housing as well as supportive services that go along with that housing. In that area, we've been fortunate that we're part of a national demonstration project called Improving HIV Care and Housing Coordination through Data Integration, which has really allowed us to look at our transitional housing program and begin to change it from a place where clients go to wait for a permanent placement into a place where they go to prepare for a permanent housing placement. And that project has we're one of 5 national demonstration sites. And it's really allowed us to look at the whole issue of not only sharing data between Ryan White and housing, but also the conversations between the providers and how we share information, how we deal with the whole needs of the clients. Another area of focus for us is service integration. When we look at that in a number of places, we are very big on integrating HIV prevention and care. We've had a combined planning council in our city since 2001. So we have one planning body that looks at both prevention and care. In the last couple of years, we've started looking at some issues around how do we jointly fund prevention for positive activities so that they're happening on both sides of the house, both in HIV prevention and in HIV care. And I think that the last area that we're looking at is really linkage to care. And how do we take someone who's been diagnosed and create a system that quickly gets them into care. So we've moved from a 90-day linkage to care measure to a 30-day linkage to care measure. We've done cross-training with our linkage to care case managers so that they're trained to do HIV prevention testing. And then I think also with linkage to care, just really looking at that whole issue of how do we shorten that time to care for clients.
How have all of those efforts actually changed the outcomes for patients in terms of their health, and what might we learn from that on a national level?
Well, as a transitional grant area under the Ryan White program, we are successful in getting over 90% of our clients linked to care eventually. Since we've switched to that 30-day linkage to care measure, within 30 days we're only a little over 70%, but we're improving that measure with each quarter as we look at our systems and how do we trim down the time that our system responds to those new diagnoses. And the thing that I'm most proud of is for the last calendar year, we achieved 87% viral load suppression.
So
which
you're
is
changing patient outcomes, their health.
Yes, we're changing patient outcomes, changing patient lives. I always talk with my folks, not only my direct staff, but the agencies that we fund, that our focus has to be on clients. It has to be on what are the client needs. I'm not here to maintain this system just for the sake of maintaining this system. I'm here to create a system that's responding to the needs of clients. My counterpart on the HIV prevention side, she often talks about this book called Who Moved My Cheese? And she relates it to HIV prevention in that, and not only HIV prevention, but HIV care. In the last 10 years, this field has changed dramatically. From the introduction of one-a-day therapies, the whole HIV care continuum as a concise way of looking at are we moving folks along in terms of providing better outcomes for them. And in that story, it's you can either sit back and rest on what you've done until you realize you're behind the game, or you can be assertively going out and looking for what's next. What do I need to be doing next? Where do I need to look next? And she's Samantha Hughes is her name, and she's been real helpful in pushing our whole system, both on the care and prevention side, towards what do we need to be doing next? Where do we need to look next?
Well, clearly you're making an impact on the HIV epidemic by doing all of those things. Thank you so much.